Welcome everyone to the Mormon Psychedelic Summit. Very excited to be here with all of you. And I'm Steve Urquhart, and I'm the founder of the Divine Assembly. That is a church with Mushroom Sacrament. You can read about us at thedivineassembly.org. And we are very excited to co-host this today with the Utah Bee. And someone give me a thumbs up in the chat. Do we have sound? Do we have visual? Okay, looks like that's a yes, right? Okay, all good. Okay, very good. Well, let's go ahead and get started. Panel number one, how psychedelics help reprogram unhealthy thoughts and beliefs. We have three panelists, Christine Stenquist, Dr. Rachel Allen, and Dr. Scott Allen. Christine Stenquist is a mother of four, a brain tumor survivor, and a chronic pain patient who became a cannabis advocate after seeking alternative treatments for symptom relief after years of failed pharmaceutical therapies. Christine's story and voice became the catalyst for the legalization effort of medical cannabis in Utah. I was able to walk with her a bit on this, and what a tremendous warrior. And Christine, thank you so much for your great efforts for all of us. As Christine's journey toward healing and growth continues, she discusses her emotional, spiritual, and political traumas and the powerful role psychedelics played in her growth. From St. George, we have Dr. Rachel Allen. Dr. Rachel Allen is a double board certified anesthesiologist and chronic pain specialist. She's been practicing in the field of anesthesia and pain management for over 9 years. She specializes in the treatment of complex pain disorders through pain management and interventional pain techniques. Her clinical interests include utilization of the mind-body connection to help patients manage and heal themselves. She also enjoys teaching her patients about their innate healing abilities and the ability to heal through nutrition, yoga, and meditation. Dr. Scott Allen is a St. George Ray's board-certified anesthesiologist. Scott has specialty training in transplant anesthesiology, but he has a special passion for improving the mental health care of his friends and neighbors in the community. He desires everyone to see their inner peace and tranquility. His goal is to provide the most cost-effective, integrated, and effective ketamine experience in the country. Dr. Allen enjoys outdoor pursuits with his family and communing with nature. He's doing his best to stay grounded in the moment. Both Drs. Allen graduated from the Medical College of Wisconsin for their medical school degrees and subsequent residency and fellowships from the University of Utah. With that, take it away, Christine and both Drs. Allen.
Thanks, Steve.
Thanks for having us. I don't have video. It says that you guys still have that. So
what's that?
I don't have video capability. It says that the host has that locked down. So
okay, so they need video capabilities. Let me see if I can do something about that. Panelists. Okay, here we go. I think I can do that. Wow, so here we go, Sarah. I see it right there, but okay, boom. There we go. Christine, I should, nope. Mute panelist. Oh, sorry, folks.
Start video. Click on that one.
You think?
Yep.
There we
okay.
go.
there we are.
Yay! Technology, we did it. Hi, welcome.
Good morning.
It's all yours.
Good morning. Hi, Allens. How are you guys doing?
Hi, Christine.
Hi, Christine. Good to see you. Thanks for being here with us. And thank you, Steve.
Thank you so much, Steve. And thanks for having me be on the panel too, to share a little bit of my story. If you guys don't mind, I'm going to start a little bit and sharing my story. And I think a lot of people are going to be interested in hearing a physician's perspective on a patient's experience. If that's okay with you guys, does that work? Okay. Thanks everybody for joining us today. My name is Christine Stenquist. Some of you may already know me. I have been a voice here in Utah on the medical cannabis effort. And I wanted to share with you a little bit about my journey since we passed the ballot initiative and where it has led me to my journey with Steve. To begin with, a little bit of my back history. I am a brain tumor patient. I lived with chronic debilitating pain, bedridden and housebound for 16 years. Was gone through many failed pharmaceutical therapies and then stumbled across cannabis and started finding some.
Christine,
Yes.
so some of the people are having a trouble hearing you.
Okay.
Is there any? Yes, I was just saying, if there's any way to talk a little louder, they're just wondering if you can.
You guys hear me better now?
That sounds a lot better on our end, and it looks like yes to a lot of people.
Oh, I'm sorry. The mic was on the other side. So sorry, guys. Okay. For some of you who didn't quite catch that, medical cannabis patient found, I'm a brain tumor patient that found relief with medical cannabis and started some advocacy here in Utah. After we passed the ballot initiative, and for those who don't know, I've been doing advocacy work and raising awareness in the cannabis space for almost a decade now. I started in 2011, tail end of 2011. So it's been a long time since I've been traveling this road trying to find myself relief. I was bedridden and housebound for 16 years and really lived a very solitude type of life. When I did discover cannabis, it mitigated my symptoms, gave me some relief, but there was still so much more missing. I had a lot of obstacles with the passing of the ballot initiative. I had a lot of political challenges, a lot of religious challenges bumping up against the LDS Church and several other large entities in the state. And it started to really affect me. Years of dedicating myself to advocacy and ignoring some of my own trials with my health had put me in a state of some serious depression by the tail end of 2018. My symptoms were getting more problematic. My migraines were increasing, and I was spiraling into a major, major depression, coupled with just the chronic pain. And as you both know, being physicians, chronic pain and depression are a very, very ugly couple, but they seem to run hand in hand most of the time. And this depression had led me to a lot of suicide ideation. And I found myself one night sitting on the suicide hotline. And that was actually the beginning of before COVID happened last January. So January 2020, I'm sitting on the suicide hotline waiting as I get told that I'm 17th in line before I can speak to somebody, a Christ worker. And I was frustrated and I hung up. And luckily I have some night owls as friends and some fellow chronic pain patients. And I had a friend who texted me, sharing with me his little graphic that he made. He runs our local Utah satire group, and the humor he always provided me cheered me up. But I sent him a screenshot of the fact that I was sitting on the suicide hotline, and he called me immediately, and he sat with me as I just cried and struggled with where I was in my life. I struggled with my identity, struggled with my pain, the fear that I might be sliding back into a homebound life because the pain was starting to escalate and I couldn't stop the negative thought patterns that I had been clinging to, the negative, the traumas that I had experienced in life were surfacing again, and I wasn't able to get to terms with it. And cannabis just doesn't help with everything. While it's a wonderful plant and I love it very dearly for giving my a second lease on life, it did not do the complete healing that I needed. And I was really struggling with my mental health. And As my friend sat with me, I told him, Dr. Talbot told me that ketamine might help with some of my migraines. With one in particular that I suffer from is hemiplegic migraines. And I decided, at least let me see if the ketamine treatment might help me in that area. And my friend stayed on the line with me. I waited for the clinic to open and I called the first local clinic, and they luckily had a cancellation and I was able to get into that slot. I called my physician back and he placed an order, and this was something him and I were both venturing into. I was his first patient that was going to be trying ketamine for pain, a specific pain, but also hopefully to treat some of this depression that I was really struggling with. And to my surprise, it really was quite effective. It stopped the repetitive thoughts that were going on that I couldn't seem to get grasp of. It helped me dissociate enough that I could organize my emotions and organize my thoughts in a manner that made sense for me to start truly healing. I'd been in and out of counseling for years. And in fact, almost every pain patient that goes to a pain clinic will have that therapist, that physician encouraging them to do psychotherapy with their pain treatments. It's just part of treating the whole patient, the mental health as well as the physical. All the antidepressants, all the anti-anxiety medications I'd ever been on never gave me that moment of relief the ketamine treatment did for me. Now, it wasn't the be all end all. I didn't walk out of the clinics after all those treatments and think, I'm cured, I'm a fixed car now. I can get on the road. I'm ready to go. It took some time, some process, some more healing. Ketamine was just the starting point for me. And you guys may be able to dive into this. It was an acute treatment for me in this particular situation where I needed help immediately to stop these thoughts and just to get me to walk back from that cliff. And it was a successful, in my opinion, it was successful. It did lead me down the path of seeking other psychedelics. I turned to my friend Steve and told him the success I was having, but I felt that there was something else missing and there was something more that I was searching for. And he shared with me his experience that him and Sarah had with ayahuasca, with psilocybin. And I decided it was time to venture down that path to see if it was something that I could potentially do for myself. Before I really got down that, I was in the middle of discussions. I had my adult child come home from what he claimed to be a very spiritual walk in the woods. And my daughter was over at the time, and he's sharing these wonderful experiences that he's had, or these enlightenments that he's had. His eyes are full of tears, which was unusual for this particular child of mine, because he is on the spectrum, the autistic spectrum. And emotional connection has been a challenge his entire life. It has been really hard to feel like I could reach him and that I could see him and feel him and that he could see and feel this world. And as a mother, to sit there and see your son being able to share how much he loves you and how grateful he is for his family and for the things that he has in life and his siblings, and being able to truly connect and to hug in a way that you're melting into each other. He's always been so stiff and reluctant in that physical connection. It was profound for me to see this experience with him. And he asked me, he says, Mom, will you do this with me? Will you do a trip with me? Please, audience, remember, this is COVID and we had nothing going on. So the beginning, about this time of year, him and I planned some time. We had 6 hours. We built a bonfire. We both are migraine sufferers. We had our cannabis, we had our day set, and we spent 6 hours just healing and bonding. Many people, when I brush over the fact that I was bedridden and housebound for 16 years, don't understand what it means to be isolated from your community. I didn't have friends. I didn't have neighbors. I didn't have people coming in, checking on us, not even our family. And the traumas my children experience from that kind of isolation, we are just now starting to unpack. And it's through psychedelics that I'm really having some healing and bonding experiences with my adult kids as we process some of this. So me venturing down this path has been wonderful. It's delightful. It's also very educational. Just like I did with cannabis, I want to make sure that I'm bringing some safety measures to patient population and further that discussion with physicians like yourself. Let us talk about these substances in a meaningful and therapeutic way. So I've talked a lot, but I would love to get you guys' feedback on what you guys see in your clinic, because I know you both run a ketamine clinic.
Yeah, so maybe we'll just start off and tell everybody a little bit, if they're not familiar with ketamine, what it is.
Mm-hmm.
So ketamine's an anesthesia medication that we use in the operating room. We've been using it since the 1960s for anesthesia purposes. But about 5 to 10 years ago, some researchers figured out it's particularly effective about treating depression, especially suicidal ideation. And it kind of sounds like that was your experience, right, Christine, where it kind of rapidly decreased the suicidal thoughts.
Yeah.
And, given over a series of several treatments, a lot of people can kind of find maybe not a remission of their depression, but at least makes it more manageable. Right. So the experience of psychedelics, ketamine medicine, and other psychedelics is usually very important in the healing process. Could you tell us a little bit more about your experience that you had during the ketamine? So like what you experienced in your mind?
Oh, absolutely. I would love to share that. So I had it done intravenously, so not IM. And once they started the drip, I was told by the nurse practitioner that was in the room that stayed with me to just let myself go. The room was very ambient. It had an ocean feel, so blue lighting, nice. I mean, the spacing was just beautiful. It helped ease my reluctancy and nervousness. Even though I use cannabis, I had some reluctancy because I've heard about ketamine as a recreation drug, the joke about being in the K-hole, the whole thing. I mean, I only heard it in passing in these sort of drug circles. And so I was like, yeah, I'm staying away from that. And so I wasn't quite sure what to anticipate. But the nurse said, just relax. And as I started to drift, I drifted pretty hard. I slipped into a dissociative state where I did start to see a little bit of some patterns, some patterning type geometric shapes. They were very, very faint, but it mostly, I was dealing with people that I was coming in contact with throughout my advocacy. I went into this with some intentions of resolving some of my issues that I was bumping up against. Losing a lot of friends during the political trial was the most prominent thing. So when I was under my visual that I was having the faces of the people that were in my lives, advocates, friends, cohorts, opponents, all of them. And as each one of these people would manifest, in my mind's eye, I would have a range of emotions behind it. But I felt very safe to have those emotions. So I would almost be playing these little snippets of our conversations or my exchanges with individuals as like a little mini reel is how it was presenting in my mind. And I felt the emotion. I felt the joy, the laughter, the excitement, the anger, the hate, the frustration, the resentment, the betrayal. Like I was given the ability to feel that full range of emotion with each person. And I felt safe and I felt okay that in my mind, it was okay to have all of those emotions and still feel okay with where I was. I was safe, I was fine. And it was a very accepting process going through that. But I went, and then I drifted in and out like a dream. Like, it's hard to tell people your full dream because you're sort of in and out in snippets. And that's what it was. And I was under for an hour. They did a long time because of the pain I was dealing with, and then the severe depression. So it gave me a lot of time to sort of drift in and out of things. I kind of bounced back a little bit in my life, in my childhood, and it gave me some moments to reflect on even in those circumstances. So it was interesting. And I did 6 sessions. So each session had its own theme almost, depending on what was going on in my life and in my environment. It seemed to, trickle into there. I had made it a point to not have certain things happen before my treatments. I was avoiding phone calls or things. I was in a delicate state still, and I just wanted to avoid stuff. This was in the middle of the session last year, and I had opened a bill file with a particular legislator to help try to correct some of the things that were going on with the cannabis bill. And I get a phone call from this legislator, and she tells me, Vickers, and I don't care telling whose name, Vickers needs to take my bill file, and they have to redo things because they've screwed stuff up. And it just set me off. Everything about the movement was still so very triggering. And I said, I can't deal with this. I'm sorry. I'm not on the Hill. I don't give a shit about what's happening on the Hill. It's not my problem anymore. Let him do whatever he wants to do. And I got off the phone, and I had traveling to the ketamine session. My daughter was with me, and I said, I shouldn't have answered the call. I shouldn't have answered the call. I shouldn't have. I got in there, and I was trying to shake off the whole situation, because we talk about set and setting when you use psychedelics, when you use drugs, and being in the right mindset and the right environment is really important to how well your trip goes. And so I was really worried that I was, I'm getting myself all worked up over stuff I can't control. And you always hear about people having bad trips. And I have a fellow activist that had said, there's no such things as a bad trip. It's an opportunity to process what's maybe something that's ugly going on. And that's exactly what happened. During that treatment, I kept popping out of it, the medicine. I just kept waking up out of it, trying to talk to him. And I said, you know what, just stop the medicine. I can't relax enough to get to the place that I need to be. And he was very apologetic. I said, no, it needed to happen, because look, we don't live in a bubble wrapped life. Life is going to come at you with things that you don't anticipate and you don't expect. And even when you're going through your healing process. And so I'm glad that I had the sort of rocky experience with having an emotional something disrupt me as I'm trying to heal. So it was an opportunity for me to dig into those emotions, to dig into the whys of everything up there being so traumatic for me. So I'm still exploring all the realms of the psychedelics and where they can lead me in my healing process.
Well, thank you. Thank you, Christine, for sharing. Thank you for sharing your story to begin with. It is one that it takes a lot of bravery and courage for somebody to share that and to be open about that. And I know that's not easy. And so thank you. And that really, stories from one another allow all of us to create space for each other too, and also to, shoulder a lot of that pain that we all have, and we all do have it. It doesn't pass over any one of us human beings,
It doesn't. I wanted to just grab some quick questions. Sarah's reminding me that there are people who are asking questions. If you want to make sure you put it in the Q&A, I'll try to grab some of them. I've got one that says, I need glasses. Sorry, folks, I can't even fake it. How similar is a psychedelic experience to a near-death experience? That's a good question. And I can share a little bit of that because I had a near-death experience on the operating table. During my surgery to remove the tumor that I had, they hit a blood vessel and I hemorrhaged and stroked and then slipped into a coma and was in that coma for about 4 days. And during that experience, I did have, and I'm still coming to terms with, to call it an out-of-body experience, near-death experience. I wasn't here in this plane of existence. And so in comparison, and I've done a few psychedelics now. I've done DMT, I've done LSD, I've done Molly, I've done, God, I sound like I'm just, hey, Sim, if you want to come on over. No, but I went in searching to find which one of these modalities best fit for me, because I know that is something for some people. It's not quite that intense near-death experience. It does mimic it. It's pretty interesting at how closely I felt. I have not tripped to a point where I've met any beings. So in my near-death experience, I was greeted with loved ones and individuals that I just didn't recognize. Some personages were in my presence in my near-death experience, whether that is what my brain was trained to recall, or if that was actual and factual is my still personal journey that I'm trying to come to terms with. But during the ketamine experience, I didn't feel like it was a near-death experience. No, it felt dissociative. It felt very distant, but it didn't feel the same. I think DMT is maybe a little bit close to the near-death experience. I didn't find it completely exact. So but I'm just one person's silly experience.
No. Well, and every experience is going to be different, as you already said, with set and setting. So, there are times that we have definitely had a lot of our patients experience what feels like near-death experiences with ketamine, depending on dosing and depending on mindset, depending on setting. And other times, like you've said, it's different, similar, things that definitely mirror each other, but not the same.
And kind of getting around to the neuroscience behind near-death experiences, they do share some similarities with psychedelics, and specifically the current theory is the default mode network. Yeah. So the default mode network is a series of structures in our brain which correlate more or less with our sense of self or our ego, our sense of identity. And in high doses of psychedelics, that default mode network is shut off. And so you kind of get a sense that you stop being an individual person. You might melt into a common existence with all of the universe. Experientially, it may be a little different than that common near-death experience that you had when you were in the coma, which is interesting because it does seem to be an experience that's shared across different cultures. And so there's something, I don't know if it's something neurologically going on with our brains. I don't know if we do travel to a different, dimension or plane of existence. But it is curious that experience is conserved across different people. I wanted to address a comment by Alexander, first about taking the SSRIs. So speaking from a medical perspective, so somebody had asked also too, you, with your son, you had an experience with psilocybin, right? When you done that. Okay. So psilocybin, LSD, DMT, ayahuasca, those all work on the serotonin system within our brains. Ketamine is a little bit different in that it acts on, it's called the NMDA system in our brain. So it's different than the serotonin system. When people are taking SSRIs, so selective serotonin reuptake inhibitors, SNRIs, and almost all psychiatric medications interact with
depression and anxiety medications.
Yeah, for depression and anxiety, they work on the serotonin system. So it is, if you are going to journey with ayahuasca, DMT, LSD, psilocybin, MDMA, it is recommended that you stop taking serotonergic agents because of the possibility of inducing what we call serotonin syndrome, which can be fatal in people.
Scott, did you answer Lisa's question about, I guess that's to me. I did not use anything else. Blake is not on anything but cannabis to treat his migraines. And he was on medication as a child, like most children in the 90s. Quickly pulled him off his stuff when he hit his teen years, as it was not beneficial for him. So currently, no, he just uses natural medicine. He uses cannabis, and then he doses. I think he's averaging about every other month or every 2 months, he'll do a psychedelic trip.
And so maybe Rachel can talk to us a little bit about this question from Erin Hyatt about how psychedelics can help reprogram unhealthy thoughts. She's got a really good way of explaining it.
Perfect.
Well, so that's a really good question, Erin. So thank you for bringing that up. In my experience in training, and especially in chronic pain, one of the things that has really stuck out with me is this idea that neurons that fire together wire together. And so as we progress through life, we have specific neurons that do fire together. And so we can see that, and these create these pathways that allow us to actually shortcut a lot of different, sometimes higher thinking and just get to a specific place. Now, sometimes those are wonderful. You get out of bed, you go to the bathroom, you brush your teeth, you floss, those types of things. It helps us remember things. Unfortunately, with traumas, it cannot be as healthy. It can be things like withdrawing within ourselves when we feel anxiety. It can be other things like, when our vets hear a big bang, they're down on the floor. It's these specific neuronal connections that have fired together that continue to wire together. So what psychedelics can ultimately do is, Scott wrote a wonderful article that talked about kind of the snow globe effect. If we have tracks in our neuronal connection, our brain, it's like those footprints, and they keep getting deeper and deeper. We have these ruts, these firings. And what psychedelics seem to do is shake up our snow globe. And as that snow lays down, you have the opportunity to relay those footprints again, and relay them in a different way. So you can rewire those neurons together. And it can be very subtle, just like Christine said, it's these subtle things that it's not always a huge, well, let's do a 180 or even, a 160. It's this subtle shift, almost as if that idea of a railroad that is off by 2 degrees is going to a completely different city. Yeah. It's the same thing with this, you can shift those neuronal connections just so much that where we are in I-15, that major highway, you start not using it anymore. It then goes into disarray, and then nobody takes that highway anymore. Where other things, healthy pathways, when I get upset or when I feel this way, when I feel depressed, I'm going to reach out to people. You start creating these neuronal connections, and even more subtly than that, it then allows us to tap into some healthier patterns, and that's where psychedelics can help rewire that.
I was going to say, Christine, I think a big component to the success you had with it is that you had done a lot of work on yourself previously. You understand the core concepts of, psychotherapy, emotional healing. Your ketamine experience actually sounds really powerful. Probably not the most typical experience that people have. I think it's because, I think you were already primed to have that because you had worked on yourself so much. So you had the language so that once you were in that type of experience, you had the language to process it.
It's funny when I went back to the clinic, the second treatment. Now, this was a very fairly new clinic. I went into the nurse and I'm like, you guys have got to have counselors attached to this clinic. The integration, like the lucky thing for me is my daughter was my trip sitter. So when I came out of the ketamine, she was there, and then she sat with me for 4 hours afterwards as I processed. And so now, not everybody has that, but having somebody to integrate and process with, because I tell people who I've sat with, you're not, not everything's going to happen that night. You're going to find more comes to you and more clarity comes to you days and weeks and sometimes even months after you have these experiences. I'm learning more about myself, more about others. I'm having more patience the longer I continue to use in a manner with intention. So it's been a delightful experience. I can feel the reprogramming in myself. All those years of going to counseling and all the chatter and all the, do this, do that, and, pop this pill. None of that stuff was working. It was all just sort of like mechanical. And I thought I'm doing healthy things, and it wasn't computing. And now it's really solidifying things. And I can even tell with my kid when he's gone for a while and he's just irritable and irrational on things, like, son, I think it's time to do a little self-care Saturday. It's time to medicate. And that's where I wish we could get to. I'm always going to come at this from the legal side of how do we push policy to get this so that we can be using this more regularly. I'm very worried about big pharma getting a hold of some of these things and us not having the access that we need. But it really is going to take doctors and patients working together, sharing experiences, and helping understand the science behind it. Can you guys hear me better now? I hope
we
so.
can hear you well.
We can hear you a little bit better now. So thank you.
Okay, perfect.
So because this is a kind of a Latter-day Saints themed conference.
Yes.
What has been, I guess, so the experience of psychedelics is inherently what we call ineffable. Like there aren't words to describe it. So a lot of people use spiritual terms to describe it because that's the language that we have. How has that, I guess, kind of shifted your view of spirituality?
It's changed a lot. I have a lot of spiritual trauma, religious trauma. I was introduced to the LDS faith when I was, 10 years old or so, became a member. So I'm a convert by the standards. And then raised in the church for, from that time until I moved to the state when I was 19, and then started falling away from it, its practices and stuff, and felt an absolute spiritual void when it came to practicing this religious faith, and just kind of pulled away from everything spiritual. I really, that was, I think, a big component of why I was so depressed too, is I associated spirituality with religion, and I loathed the faith, and the practices surrounding it just left me hollow and empty and full of shame and self-loathing. And it was the opposite of what I thought spirituality should be. And so it was honestly when I talked to Steve about that spiritual connection, I had this lovely experience with my son, and it was beautiful, and it was bonding and everything. And I turned to Steve and I'm like, that was the most spiritual thing that I had. I mean, to bond with my kid, why isn't that spirituality? Why isn't that a religion? He's like, it is. It absolutely is. We all carry the divine within us. And grabbing a hold of that concept and starting to really dwell on that and start healing some of the things from the faith that I felt were harmful, and finding the good. To be honest, it was hard for me. I lived in, truly, I've watched people leave the faith, and we all go through a cycle. There's this nasty little teenage years of like, I've got to break every word of wisdom there is, and everybody's smoking and drinking coffee and tea and, hoeing it up. I mean, you see it in all the different groups. They just go through this crazy cycle. And then there's some of us who are like, I don't hate, but I need healing. And I need that spiritual connection to come back to me. I need to find that again. I need to get through the dogma and really deeply connect to who I am and who you are as an individual and find that love again. Because that's really where it was for me. That's what I loved about just community. I love the feeling of people coming together and putting positive energy together. And I just was missing that when you go to faith and it's full of dogmas and hoop jumping and not measuring up and doing all these other things. It just felt so void of love. And using the psychedelics and connecting with others and doing community building activities. My friends in my community were focused on helping the homeless. We're still focused on helping patients. That is bringing us the spiritual growth that we're seeking. And it's really coming from human connection and showing love.
Yeah, I like how you say that the human connection, that was an aspect you had with your son. It's kind of inherent to a lot of the psychedelics where we have a connection more to ourselves and to others and to the universe as a whole. And it sounds like for you and for a lot of us who have, left the LDS faith, there is a traumatic experience of having your worldview kind of shattered. And it sounds like psychedelics have helped you kind of reclaim a spiritual connection to the universe.
Yeah, it's been really, I grew up outside of Utah in the mission field. I grew up in Arkansas. Bednar was my bishop and then our stake president. So I grew up in a very different type of atmosphere where you were among very few Mormons in the whole town, and there was a sense of community and coming together, and it was just a bit different. And when I moved here to Utah, it's just hypercritical because of the high concentration. And I saw a lot more hurt and pain than I'd ever experienced before. And it's been so beautiful to find some ex-LDS who have also found psychedelics, who are finding that love and that ability to heal and bond again with others, because it does rock you to your core. You don't know if you can trust again when you're raised in such a vulnerable faith and there's so much trauma around you. It's hard to find that again. And I'm so appreciative of those that I've found through psychedelics who are going through their healing process, and also the doctors like yourselves who are so open and willing to talk to patients, because we really need you as allies out here. These legislators are assholes. They think we're crazy, and we need your voices to help champion this access for us.
Well, one thing I am encouraged that the medical community is embracing psychedelics. We were just on a podcast yesterday with the Journal of Psychedelic Psychiatry, which who would have thought that would have ever been a thing, but it's a legit branch of medicine now. So
absolutely. And like you said, I think it's bringing a lot of us together, because like we've talked about, trauma does not choose specifically based on socioeconomic status or gender, race. It doesn't matter. It happens to all of us. And so I think I love how you focus on the love and the connection and the spirituality. How many things, we're going to, a lot of people go to psychedelics because of the tearing apart and the trauma, but yet it's the love and the connection that truly comes out. There were a couple of questions that people have brought up.
Yeah, and Rachel can probably talk about the SSRIs and opiates to an extent.
Yes. Yeah. So somebody brought up, how does one titrate off SSRIs or opiates safely and long enough to be able to ingest the entheogens? One thing that I would just, I can definitely talk about opioids. Opioids are very unique in that you may feel like you want to die when you're coming off of them. but very, very unlikely that anything bad really will happen. Benzodiazepines, things like Xanax or Valium, those are much more dangerous. And those I always tell everybody, do not just go cold turkey off of those. Those you actually can have seizures and die from. So these are things and substances that I would really want you to work with your provider, who's one either prescribing it or the provider who'll be giving the ketamine, to help slowly titrate off of those. Opioids can be generally done. We usually say about a 10 to 15% decrease in what you're using every 1 to 2 weeks. So, and then that kind of just progressively goes down. Benzodiazepines will be longer. It depends on how much. There was one person that actually talked about lifelong use of benzodiazepines. Those, I would say, you're going to need months and months. And I have helped a ton of people get off benzodiazepines. And every patient that has, and it's 100%, my patients have said, it was hell. Mm-hmm. It was the hardest thing I've ever done. Mm-hmm. But it was the best thing I've ever done. Yep. And thank you for giving me my life back. Like, exactly. And now the person I am. I had the most adorable patient who told me, I used to be part of Mensa. I used to be able to do all these computative, smart, analytical things. I went on it because my doc told me to after my husband passed away. I'm still on it. I'm like, why are you still on it? She's like, I don't know anymore. So I said, let's get you off gently. She mm-hmm. told me, oh, honey, that was hell. But I'm now back on Mensa because I had fallen off. So those things I would say, talk with your providers. You can get off of them. Do know that you're in for some struggle, but you're not alone in doing it.
I used cannabis to come off of all of my pharmaceuticals, and it was hell. It absolutely was. But man, cannabis helps with those withdrawals. Whew, they help with those, because during those 16 years, I was on a fentanyl patch. It was on fentanyl. I mean, they choked me all the way up. I would have to go into the hospital and they would detox me, just winging me down off of my meds. So I'd have more of a ceiling for when I had my emergency room visits. So the Dilaudid would be effective. You know how nice it is not to have any, I know I am not like everybody else. I know not every patient gets to say I'm pharmaceutical free, but after so many years of having that, I mean, I've lost 80 pounds, up, mobile. It's just a different life. And I'm so grateful for not just cannabis, but the psychedelics now. To have those two together, what a beautiful little couple they make.
It's awesome. I have so many patients that say the same thing. So
there was a question specifically about ketamine to help with benzodiazepine withdrawal, and it has been my experience that ketamine does help with the anxiety for people who are motivated when they want to like decrease the amount of benzodiazepines they're using. It's been my experience that people, if they don't come off completely, they're able to wean down to a manageable level.
But just like you said, this isn't a magic bullet, but
right.
If you could use something that has the least amount of side effects, that gets you where you want to go and can help you get there, why wouldn't we use it other than another substance that does have properties that are one, either addictive, or two, at least dependent is a better way of saying it. And there was another question I did want to answer about ketamine causing a purging. I would say about half of our patients have a purge, or a quarter to half, depending.
Yeah, maybe especially the first time, because it can, well, we're all holding on to a lot of trauma, and there does seem to be a relationship towards letting go of trauma and, you know, a physical purge. And that was your experience.
I did throw up the first time. Yeah. I did throw up the first time. He added some medicine the second time, and subsequently afterwards, I didn't have any problems with it. But yeah, I did have some nausea with ketamine.
Yeah, and then I find, like, for most patients, after that first initial purge, subsequent treatments get a little bit easier to tolerate. It's definitely not like ayahuasca, where you're just that's part of the ceremony is puking. I don't know. It's not my cup of tea. Pun intended. But I don't know. Ketamine, mushrooms, LSD. Those seem to be a little bit easier on people's GI system.
Mm-hmm.
Absolutely.
Oh, perfect. So did we capture all the questions that there was? I want to check our time. Oh, we've got 10 more minutes.
If not, we can always talk about ketamine clinic and kind of how we often bring people through.
I really think you should. People have asked me if ketamine, I like the fact that I had ketamine as a precursor a little bit to the psilocybin. Well, even towards the others too. It was a nice kind of launching pad, if you will. Will you guys share a little bit about what that's like and what a patient could expect if they were wanting to seek that as a treatment?
Absolutely. Do you want me to start?
Yeah.
So a vast majority of the time, what we love to do is to have people, Christine, much like yourselves, who one are interested and motivated. You know, this is going to be a psychedelic experience where you will become and delve into some uncomfortable things. So people who are motivated do best. So usually they come to us, they find us. Or honestly, what can also happen is as we've gone throughout, we've developed a lot of rapport with a lot of our therapists. And as you can imagine, in very LDS culture within St. George even, it has been a unique struggle to kind of break into that. So we have started to kind of expand that awareness of what is ketamine, what are psychedelics, why are these helpful? Yeah. As that's happened, and as we've seen people, Christine, like yourselves, who are like, no, this has really helped me. It's gained traction. So we're getting more people from there. When people come in, we like to walk them through the process, know what they're getting into, what to expect. Yeah, we have you fast for 8 hours before, so if you're going to puke, at least it's less,
less to clean up.
And for yourself, it feels less yucky. We want you to come with a driver. We want to walk you through what it is. We also want you to see that set and setting. So one of the things that we really wanted to create was the living room feel. The feel that when you're in our clinic, yes, it's monitored. You have physicians or licensed nurse practitioners and providers with you, but it also feels homey. It feels warm. We give you a blanket to snuggle up in. You're in a chair. Stuff like that we want you to see and feel, so it doesn't feel odd or cold the first time you come in. So that mindset isn't racing. You don't get that phone call and like, where am I? What am I doing? I don't want to be in this headspace. Yeah. And then, we will choose kind of the dosaging specifically on weight-based and also what patients' experience has been. If you're well experienced in psychedelics, you want a little bit deeper experience, we have the opportunity, and Scott is really good at this, of really pushing people artfully to that point where you can go deep, but you're also at that brink where we can pull you out. Yes, and that's the art of anesthesia. Why we enjoy it, and that's what we do for a living. Yeah.
Can I ask you, do you guys do IM or do you IV or do you do a mixture of both? And what's the difference?
Mostly we do IV because we find that we can control the experience better for people that way.
For sure.
And we know from the psychedelic literature that the quality of the psychedelic experience correlates with the degree of depression relief. Mm-hmm. So we really go to great lengths to provide a good quality experience for people. We do IM treatments. We're actually doing some home treatments for people too, and we use IM injections for those. The difference is like IM injections you just get shot off like a rocket. And you don't really, you have whatever experience you have, which can be okay, but it's just we like to have a little bit more control over what people are going through.
I did feel like I had that control a bit too with that. I've had patients tell me experiences with IM as opposed to doing it an IV. And IM, for those who aren't knowledgeable, is intramuscular. So, and they had to have the shot done a couple of times through. So you're going up and you're coming down, and you're going up and you're coming down. I couldn't imagine that. That doesn't sound very pleasant at all. But this has been a very fascinating experience. Like you guys, I got a phone call this morning from somebody within Utah in our space, in our healthcare space, who was wanting to ask a little more about psychedelics and mental health. So this is definitely something that is coming. We saw legislation pass in Oregon and Washington. What me and Steve Urquhart even spoke to the therapist behind the Oregon effort for the initiative there for psychedelics and use in therapy sessions. I would love to see that component here in Utah, especially with the high suicide rates that we have, the teen depression. Let's be honest, there's a lot of mommies here that could use some help. Like, it's a stressful environment. So I'd love to see this conversation continuing and seeing some more spiritual growth happening for others in the state.
I want to speak along those lines to a question Andy Z had posted about personal experimentation versus having a guided experience. There's nothing inherently wrong with kind of going off on your own and doing mushrooms in the desert, but it's always better to swim with a buddy, and you're going to be a lot safer that way, so you don't have it could be physically dangerous for you, let alone psychologically dangerous. It's important, I think, when we're talking about psychedelics, and this is what I like how Steve has gone about with the Divine Assembly, is creating a container for the psychedelic experience. Because it is such a boundless spiritual experience, it's important that we have a mechanism to make sense of it afterwards and apply it to our lives. A lot of people will get caught up because it is, usually the best experience people have ever had in their lives. You can kind of get all sorts of different, spiritual connotations with it, like, traveling to the fifth dimension and talking to alien beings, and that's all great, to add a richness and variety to our lives and a spiritual dimension. But it's also important, how do you apply that to the here and now? How do you make that experience applicable to what we're actually going through as a common humanity? And so that's why I do think having that container to make sense of it is important. And we call that process integration. So we offer integration services at our clinic to help people make sense of the experience.
Oh, that's wonderful. When I've noticed when I do my dosing, I haven't done a hero dose yet. I haven't gone to meet the aliens or I stay within a gram to 2 gram dosing, because I found that really helps unlock my art and my creativity. I don't like to babysit myself on substance. I or others, to be quite honest. And so I've not gone to venturing into those deeper limits.
Well, and I also think there is something about intuitive medicine too. You know what I mean? I think this is where, as you know yourself, as you begin to know yourself better, and 2, as you develop that bond and rapport with your provider too. This is where I love. This is the beautiful art of like seeing each other and being able to say like, I think you're ready to go deeper and to maybe perhaps unearth some of those traumas that we have been hiding because we haven't been ready for it. Yeah. There's a time and a place for everything.
There is, and that's a truth for me. I've got some deeper stuff, and I've just kind of surfacely like, okay, I've had the swimmies on, just taking a spin around the spiritual psychedelic pool.
And so sometimes we need a little kick in the butt to say, it's time.
It's time to go deeper. I keep telling Steve, I keep telling him like, I'm ready. And it's just, it's needing to get there, It's been,
you'll know when it's ready for you.
Yeah. Well, the nice thing about all of this is that I don't feel pressure. I don't feel pushed if I'm not whatever this may be ready for me. And this may be just what I needed to keep me on the path. That's the nice thing about all of this. I'm just thrilled to find something that's plant-based medicine that is tapping into our own body's natural curiosity, I guess. Our bodies are reacting to these substances in a meaningful way. And I think because they have been prohibited for so long, we have lost the art of knowing how to use these plant medicines, and we're coming back into that art. And I'm really excited about where it will lead us. I'm apprehensive about it turning into, we don't need a bunch of celebrities in the psychedelic space. Let's be mindful that this is a very spiritual practice. This isn't about creating superstars or superstar brands or anything like that. That's just my caution from the cannabis space that I'm bringing to the psychedelic space. We don't need brand ambassadors. We need to keep this intention pure and be mindful that many of us do use this as sacrament and as healing and as a tool in our spiritual growth and journey. I'm seeing a lot of it already happening, and I'm nervous about it. So I'm hoping in Utah, as we start to create our community, that we're mindful of the pureness that we're all going for and the safety that we're all going for. But Sarah, I don't want to overstep and be on too long. Are we good, or do you need us to continue? No, if she's still there. Oh, there's Steve.
You have instead of Sarah right now. No, that's good. If you have any final thoughts, you're scheduled till 11:10. So if you want to have a 3-minute lightning round, but this is fabulous. Thank you.
Well, Drew brought up one good thing here. He asked, and maybe Christine, you can answer this too. As you've kind of started to reprogram, the old programming from the church, are there any resources, books, templates, things that you have used to create kind of those healthier thought patterns, the spiritual growth? Because often we find that it feels like we're making it up as we go, and some things work and some things don't.
That's what it does feel like. Many people have started referring books to me. It's funny. There's a person that kind of ventured into my life that I found to be quite helpful. And I wound up doing a podcast for him, and he does the Infants on Thrones. And I don't know if anybody in the LDS community knows about it, but it started out as a podcast that sort of was, ribbing and poking fun at the LDS church. But Glenn has now started to talk about the psychedelics and the healing process and what so many of us who have left the faith are now finding with psychedelics. So if you get a chance, Steve and I have both done his podcast as we start to talk about the, different spirituality. I have not ventured into finding a book to find some of these sources, because to be very honest, like I said just a moment ago, I'm not looking for a guru. I'm not. A big reason why I left religion and that whole, structure is I don't need another human being to be my God or my savior. I'm trying to find that within me. And I haven't ventured into the books because I'm still trying to get to know me without all those levels. There are, like Steve, I know probably has a ton of books that he has read because he's made it past some of these steps that I'm still getting through. But no, I haven't found a book yet that I've ventured into to start healing some of that. Mostly it's been pulling from my counseling that I have done over the years and just doing some of my own healing with myself and with my family members, and not really getting into the muckety muck of what happens when we die. I'm just trying to live in the here and now and figure out how I can love myself and my family and friends a little bit better.
Yeah, I think it's tempting to get into the metaphysics of psychedelics because it's such a crazy experience. But I like what you're saying about focusing on the here and now and on the relationships that we have around us. Yeah. And then I'll maybe end. Heather Campbell had a question about the indigenous shamans having a container for psychedelic medicines. It's true. They had really good, containers for it. Mm-hmm. I think we're starting to develop what that means in Western society. I don't think it's going to look like the traditional, Amazonian ceremonies.
Right.
It'll probably be a hybrid of, some sort of Western traditions, maybe mixed with, medicine. I'm not sure what it's looking like, but I think like through processes like this is where we're starting to develop those protocols.
And I really think we need community, us, those who are venturing into it, physicians, advocates like myself, but also community people who are interested. We need to create the movement. We need to not default to others and say, you lay down the rules. We need to be participatory in how this unfolds for us and how we start engaging with these plant medicines. My 2 cents.
No, and I love that. And supporting those who are doing it from that space of loving kindness,
right,
spirituality, and also ethical. And so yeah. I think
because we live in a capitalist country, it just is. and they're always looking for the almighty dollar, and that's not what this is about. No. So Thank you very much, guys. Thank you, Divine Assembly and the Utah Bee, for having me. I'm so thrilled to be part of this. And thank you, Alan. I'll see you guys very soon.
Yeah, thank you. We'll see you.
Hey, this was so fantastic. Thank you. What a good start.
Okay, thanks. Thanks,
you
Steve.
all.
Cool. Thank you.